So tonight we have a very special guest, and Dr. Shoen has been very gracious with his time. First of all, thank you very much for that, Dr. Shoen. And he's a gentleman who has been around veterinary medicine for quite a while. And so he has a wealth of knowledge that he's stored up, having started conventional, if I'm not mistaken, and then coming over to the dark side, really the light side, and integrating some of these really amazing treatments that there are in this world and in various parts of the world that maybe some of us aren't very familiar with. So he's going to be talking about some of those, as well as some of the ideas of mind-body medicine and some of the scientific ways that works. I'm excited to hear and see some of that. So if you have questions, last comment before I turn it over, do comment them in the chat section, okay? So go ahead and ask questions at any point in time, and we'll try to get those answered if we can. So with no further ado, Dr. Shoen, let's go ahead and hand it over to you, and I'm going to get your slide presentation up and going here. Why don't you just give us, though, a brief introduction of who you are?
Okay, yeah, we can start with that, and then you can add in the slides more. Yeah.
Sounds good.
Well, thank you, Jonathan, for inviting me onto the O3 webinar, and it's a joy to get to know you, and it's a joy to meet everyone out there. And some of you, I'm sure, we've connected at different conferences or somewhere, and for anyone new, welcome. And I'll just share with you a little bit about my background, where I'm coming from, so you have an appreciation of the foundation of where I'm coming from, and then where that's can take us, okay, in the 21st century, now that we've just started on the 2020, the third decade of the 20th century, of the 21st century.
Going fast.
Yeah. So the topic today is creating a 21st century veterinary integrative practice. And in this slide, I don't know if they can see that.
Let me start it for you there.
The next one, yeah.
And you can just click actually at on the bottom of the screen there, Dr. Shoen, next or previous, and it'll move for you.
Oh, okay. I'll try to find that. Oh, yeah, I see that. Okay. So this was the cover of Veterinary Economics back in the 1990s, what the future holds for veterinary practice, a look at 1993 and beyond. And the reason I have that slide in here is because back then I was already foreseeing a whole new vision of what veterinary medicine could be like, a much more expansive vision than what it was limited to at that time of conventional medicine and surgery. And let me just share, my approach is integrative. I love conventional medicine and surgery. This is not instead of, it's in addition to, it complements it, okay? So, like I graduated from Cornell Veterinary School. I also have a master's degree in neurophysiology and animal behavior, and I received an honorary PhD for my contributions in veterinary medicine. And so my approach is, let's do the best we can with conventional Western medicine and surgery. But my personal passion was seeing what could we do for the animals that didn't respond or had side effects. Okay, so even back then in the early 90s, I was being asked to teach and share what my vision was at that time. Let's see if this works on, okay, it does work. So back then in 1982, I started pioneering the integration of the scientific basis of veterinary acupuncture as one therapeutic approach that I felt had a great deal of scientific merit and foundation, but that wasn't being integrated back in the early 80s. Back then, if you mentioned acupuncture as a veterinarian, everyone thought you were a yin-yang. Okay, and as this slide shows, this was a book way back then, Beyond Yin and Yang, How Acupuncture Really Works. And with my background with a master's degree in neurophysiology, this is one of the things that got me very excited about acupuncture, was that it actually was a scientific approach to helping animals heal that couldn't be helped any other way. So for any of you who are not familiar with my background, I've been pioneering what was the acronym back then was CAVM, Complementary and Alternative Veterinary Medicine, which then eventually evolved into Integrative Veterinary Medicine. But I've been doing that since 1982, when I established the very first department of veterinary acupuncture outside of China at the Animal Medical Center in New York City. And at that time, that was the largest animal hospital in the world. And the head of it, Dr. Bill Kay, was a real visionary, and he brought me there to first present the scientific basis. And he says, you're the first person that's explaining acupuncture based on neurophysiology and Western science. And so he said, what we'd like to do is do an experiment here. And what we'll do is any animals that we feel we've done everything we could with conventional medicine and surgery, and then we recommending euthanasia, what we'll do, we'll refer them to you. And I went, oh, great, and my attitude was, okay, that's actually a good clinical trial, in the sense that if at that point nothing at the best animal hospital in the world could help, and if acupuncture could help, it would really document it. So obviously I turned down many of the cases, many of the patients, because I didn't feel acupuncture was appropriate. But the ones that I did accept, at the end of that study, what we found was 80% of the dogs and cats that had previously been recommended for euthanasia, 80% of them stayed alive, improved in quality of their lives, and had a much longer lifespan. And as you can imagine, the clients who had those animals were just thrilled. And interestingly enough, one of those clients happened to be one of the donors to Animal Medical Center. And he said, why are you doing this just as an experiment? You should be part of it. And I said, well, we're just doing it like this. And then he says, well, if they didn't want any more donations, I want to see a department of acupuncture here. So what happened was he said that to the head, and they went, okay, with these donations, we'll set up a department of acupuncture. And interestingly enough, on the bulletin board it's an 8-story building, hospital. At the beginning, at the entrance, it has in alphabetical order all the departments. Well, acupuncture being an A, it all of a sudden showed up as the Department of Veterinary Acupuncture. And then everyone started asking about it. And interestingly enough, then all the interns and residents that were going through AMC at the time, many of them were watching, studying what I was doing, and then they went off to different veterinary schools and other new centers, and they said, boy, Dr. Shoen has set up this department at AMC. We need to have that here. So what happened was they started inviting me to lecture at all these other veterinary schools and centers all over the world. And then Dr. K, the head of AMC, was also an editor at Lippincott at the time. And he said, Alan, would you do a first textbook on veterinary acupuncture? And I went, sure. I was just this idealistic veterinarian, so excited that you could help animals that couldn't be helped any other way. So anyway, that's where the first book that came out, I edited it, at that time it was Lippincott's Problems in Veterinary Medicine, but then it evolved into the textbook, Veterinary Acupuncture, Ancient Art to Modern Medicine, that was first published by Mosby, and then Mosby got bought up by Elsevier, and it's with Elsevier. Then I was asked by the same publisher, said, what else are you doing? And I said, well, I'm exploring a lot of different complementary and alternative therapies that I feel have a good scientific basis. And they said, would you do a textbook on that? So I was so busy at the time, so I asked a new colleague of mine, Dr. Susan Wynn, to co-edit that with me because I needed some assistance in just going through it all. So we co-edited the textbook of complementary and alternative veterinary medicine back in 1998, and that was the first textbook on this whole field, and that's what created this field. Once that happened, then all the veterinary schools were asking me to lecture on this, and I ended up becoming a professor, clinical assistant professor at both Colorado State University Veterinary School and Tufts University of College of Veterinary Medicine. And at that time, then, I was also being trying to get the word out to the public that this was a whole new field in veterinary medicine, and that there were veterinarians who were getting trained in these different therapies. And so that's when I was asked to write this book of Simon & Schuster, my first book for the public, Love, Miracles, and Animal Healing. And then later on, Random House asked me to write a follow-up called Kindred Spirits, How the Remarkable Bond Between Humans and Animals Can Change the Way We Live. Mm-hmm. And in those, I brought in the scientific basis of all this, but explained it to the public. So that's a little bit of my background there.
That's amazing. Now, I had one question going back to what you did at the largest veterinary clinic there in New York. Did they allow you to do other treatments, or were you just doing acupuncture on those that were coming in to be euthanized?
Jonathan, that's a great question. Actually, at that point and in that study, all I did was acupuncture.
Wow.
Okay? We were very strict on that. And it was like, recommend for euthanasia, try acupuncture. Like I said, there were many I turned down, but the ones that I did accept that I felt where acupuncture had a scientific basis and possibly to help, 80% of them. Later on, AMC was seeing what I was doing in my own referral veterinary practice of adding other approaches like chiropractic, Chinese herbal medicine, Western herbal medicine. And then they said, do whatever you want. We'd actually love for you to have a whole department of integrative medicine here. But at that point, I was so busy everywhere else, and I was commuting 2 hours from upstate New York, Connecticut, where I was living, and the traffic in New York was getting more intense, and I went, okay, I've had enough. I planted the seeds. I trained other vets at Animal Medical Center to do the acupuncture. So, and I was there for 9 years till 1991, and then I turned it over to my students who had done internships and training with me.
Great.
And by then, yeah, I was getting asked to lecture all over the world. And then in 2014, I was actually acknowledged as one of the 15 most influential veterinarians by my peers for pioneering all of this whole approach of complementary alternative / integrative medicine. And also received a Lifetime Achievement Award for my contributions to veterinary acupuncture. So enough about a little bit of that history. What I thought I would do now is just share with you, here is what an integrative veterinary practice looks like in the era of 2010 to 2020, or even from the 1990s to 2020. And number one, it includes the absolute best of conventional medicine and surgery. Okay, again, that is part of that. And along with acupuncture, what's called chiropractic care or other manual therapies, osteopathy, things like that. Botanical medicine, which includes traditional Chinese medicine, Ayurvedic herbal medicine, which is Indian, as well as Western herbal medicine. Nutritional supplements, low-level laser therapy, biophotonic therapy, which I've been using in my veterinary practice ever since 1982. But when I saw the latest research that multi-radiance lasers did, and they've been really funding so much of the best quality research on class 1 low-level lasers. These are the safest ones. And so I've integrated that, and it's also called biophotonic therapy, but low-level laser therapy is an integral part of integrated veterinary practice. And, even now what's evolved into is a company like Multiradiance actually has a thing called the My Pet Laser, which you can find on my website. And with that, you as a veterinarian can actually rent out the lowest strength, ones that are super, super safe for the public. And you can be doing acupuncture or laser therapy on your patients in the hospital and then send them home, rent them out, these other ones that they can use at home in between to complement the therapies that you're doing in the clinic, which is a whole other new approach. And that's only been available the last few years. Then there's also, as many of you aware, stem cell therapies, PRP, things like that are coming around, and other miscellaneous therapies. So that's where we are, the state of the art currently. So I'll just share with you a little bit about my philosophy in this and why I was accepted so well at like the Animal Medical Center and at all the different veterinary schools around the world that I was teaching at, and the two that I was an assistant professor at. Is, to me, no one form of medicine has all the answers. It just seems sensible to integrate the best of conventional medicine along with the best of complementary and alternative or integrative medicine to create a more expansive, holistic approach to animal health care. It just seems sensible. If a therapy meets the criteria that I consider important, then I consider integrating them into a more comprehensive approach. So the criteria that I use are, and ideally, I'll start this off, preface this with, ideally, double-blind placebo-controlled trials are wonderful, they're an ideal, but they cost hundreds of thousands of dollars, and even the head of New England Journal of Medicine has acknowledged there's an inherent conflict of interest with so many of them because the funding is coming by the companies that have an inherent interest in them. The whole concept of independent studies with funding changes and everything has kind of devolved over the last 20 years. So my criteria, because if you wait for these double-blind studies, there are thousands of animals that could have been helped that weren't helped. And my attitude, I wanted to help the animals that needed it, that were going to be euthanized, where I felt there was enough scientific basis we could help them. So the criteria that I use are, number one, does it work? Okay? So I would look and say, okay, this seems to work. Number two, is it safe? Or are there no or minimal side effects, weighing the risk-benefit ratio of each therapy? Number three is it reproducible? Is this something that just worked on this one dog or cat or something, or a horse? Or is it something that, wow, this is really reproducible? Every time I use this approach, maybe not every time, but the majority of times that use this approach, it has these beneficial effects. Fourth is, does it have a scientific basis? Okay, if I can justify it saying, okay, based on the latest research in science, I can explain this, then I look at, are there any clinical studies? Now, sometimes clinical studies, they only start after you start looking at what's too often subjectively called anecdotal evidence. But everything starts with an anecdote. To me, a well-published, well-documented anecdote is an N of one, a study of one. Okay, so you first start and you say, okay, does this have a potential working? Two, does it have any side effects we have to be concerned about? Is it reproducible? Does it have a scientific basis? Then I'm going to try it. Then I start collecting data on it and saying, wow, okay, this is reproducible and has a scientific basis. And then I would start writing papers, research papers, and lecturing on it, because I was blessed with some clients had a small nonprofit foundation and they gave me a division in it. And then other clients they were so ecstatic about and grateful about how I was helping their animals, they would give me some funding donations. And that's what I would use to start publishing the papers and the lectures where I was saying, this is worth exploring. And then after that, then studies would start coming out. You know, a good example of that is I was lecturing on the Chinese herbal formula Hunan Payao for bleeding disorders and using it in my practice since 1982. It's only recently that Cornell did some studies on it and other places, and it's published. And now if you Google Hunan Payao, you see it used almost everywhere to stop bleeding in dogs. And if I waited till then, there are thousands of animals that would have died, as well as we wouldn't have had the initial anecdotal and clinical experience that gave the basis to do further studies. So
Yeah.
I hope that makes sense to everyone here.
Yeah, I got a couple questions here, and one is from somebody who's watching this right now, and it's a practical question on low-level laser, and they say, does low-level laser used alongside of acupuncture points, or is it generally over pain areas of pain? What would you recommend?
That is a great question. The answer is both. Okay. What's nice is you can use it on acupuncture points for animals that don't like needles, they're scared of needles, on acupuncture points that are difficult to get to on an animal, like on the ventral abdomen or something. So it's definitely beneficial for that. But it's way beyond just acupuncture. You can use laser. Just let's say you have a dog with severe chronic degenerative joint disease in the hips or the elbows or the knees or the back. You use the laser on it, and this is one of, again, the amazing things is you see a clinical response within minutes with an appropriate low-level class 1 laser. Within minutes, the animal is happy. And, you know, I have two relatively recent examples of that veterinarians can relate to. One of them is I had this Afghan that had severe lumbosacral sacroiliac disease. And it would come in and it would just back up into me waiting for acupuncture. Okay. And if you put the laser on, I would just fall asleep. Another one that is a really recent example is a 15, now 16-year-old yellow lab that was being treated, excellent treatment by conventional veterinary medicine using medications and everything. And it had significant lumbosacral and lower lumbar spondylosis and ventral bridging spondylosis, and it was showing up, getting progressively posterior paresis, fecal incontinence. It couldn't get up. It was having a hard time getting up and down. It was getting some regular acupuncture by their conventional veterinarian, by one of the vets in the practice who was doing acupuncture, and that certainly was helping, but it wasn't lasting. Well, they tried the low-level, the MyPet laser for multi-radiance, and the dog improved so quickly and then did really, really well to the point where it had no more fecal incontinence. I did show them how to use a little acupressure on the one point, but they were using and they were still going for acupuncture to the regular vet, but in between, they were using the laser, the low-level laser on the back, and the dog was wagging its tail, running, jumping back up on the bed, running outside, and the dog loved it so much, and they loved doing it because it bonds the animal. It's a human-animal bond. I always joke and say, does the name Pavlov ring a bell? The animal feels so good after the laser that they come over to you. So this dog will go over and start pawing at its pet parent till it gets the laser. And they don't put the laser on it, and the dog just wags its tail and waits there. And it's now the dog's going on 16 and running and playing, where a year ago it was going to have to be euthanized.
So another question coming from Christine. She asks, she uses a CC loop. Is that the same as a low-level laser?
Okay, these are great questions. No, the CC loop is an electromagnetic loop. Okay, this is magnetic therapy. And a CC loop is great also. I don't have one, but I've heard from colleagues of mine who have one how pleased they are with it. So that is part of integrative therapy, and that's another very, very beneficial approach.
Yeah, and so I had a question now, and I want you to get to the rest of what you're going to talk about.
Yeah,
and I want to talk a little bit about ozone therapy too. But so what you say, does it work? You know, is it safe? All these things. Now, I think it was back in the 1700s that they started discovering a little bit about what placebo medicine was and how that worked. And before that, they didn't really understand that. But you know, so one question that I have is, are there treatments out there that you have used or that you know of that you would recommend not using because you just don't believe that they do work? You know, because there are so many things to choose from and a lot of modalities. And I didn't know if there would be something that might come to mind. I didn't prep you for this question, you know, but, you know, in your experience over the years, I would think you'd come up against some of those things and say, you know what, this is just not enough evidence, or it just doesn't work?
Yeah, Jonathan, that's a great question. And actually, you didn't prep me on a lot. And it's great. That's good. It's just good. We allow it to flow and unfold. Yeah, there are a number of therapies. They were used to, going back 20, 25, 30 years, when I was the pioneer in all this and getting recognized, so many companies would say, here's my instrument. Okay, it's a new type of electroacupuncture unit that doesn't use needles, and there's one that uses radionics, and then there's one that uses different Rife frequencies and this and that. And I've studied those things, and I felt like they're fascinating, and I was very open-minded. My attitude is the mind is like a parachute. It works best when it's open, okay? Mm-hmm. But you don't want it to be so open that your brains fall out, okay? You want to have discernment, open-minded and discerning. And so anyway, there were things like certain Rife units, certain radionic units that I said, okay, give it to me, I'll try it. I never charged the clients for that. I would just try it. And I didn't see the results. So back when I was just a couple of years ago, when I was retiring from active practice and sold most of my practice to one of my associates, I found this one closet with all these old electrical instruments in it. I went, oh my God. And I went through them saying, yeah, that one didn't work, that one didn't work. Or maybe they work, but they didn't work in my hands, sure. Number one. And number two is maybe they work, but they required a lot more training than I received. Or three is they didn't work as well as other modalities that I was already using, So that was one of my other criteria is that does it work better, faster, easier than what I'm doing already? And if it didn't, then it wasn't worth adding.
Good.
So we can keep on. Gosh, I love sharing all of this because after 40 years of doing this, it's still my passion to try to help veterinarians and help animals and help, human caretakers and animal lovers to help them with all these different approaches. Mm-hmm. So here are some of the other additional therapies that I see that are, being used already and that are going to be used more and more. Okay. So additional therapies for the 21st century practice. I had mentioned the multi-radiance biophotonic My Pet laser already, and it won't. So you can go to my website, drschoen.com, and email me if you're interested in that more. Second is ozone therapy, which, Jonathan, I really want to commend you. And this isn't prepared or anything; it's just spontaneous. But that how you're pioneering bringing ozone therapy into veterinary medicine, because again, we hadn't discussed this all before, and true confessions, okay? Going back to your last question, are there things that I used and then stopped using, okay? 25 years ago, I got this really old, one of the pioneering ozone machines, okay? And it was really big and noisy.
Okay, so this is the end of our presentation. So I'm just kidding. I'm kidding.
Yeah. So anyway, and it used ozone from the air, and so I was using it on myself, and I always joke. I say I don't use anything on the animals I haven't tried on myself first, and it's true. I always try things because I want to see what the experience is. Mm-hmm. Well, that one you had to be in a tent. Okay. Mm-hmm. And you had to make sure that you weren't breathing it. You had a towel wrapped around. You'd sit in this tent, and I'd watch some interesting videos or something and continue it, and I'd sit in the tent. And it was bulky. It was, sitting, but I did find benefits to it. But then I said, well, how do I apply this to animals? And so we tried putting filling up a bag around the animal with ozone, wrapping it around so it didn't breathe it. But with the skin, with thick hair coats, it was hard to get absorbed. It seemed to help, but it wasn't dramatic enough in that way. And it was a pain in the neck. So I stopped using that. And it was only recently when I re-educated myself on ozone, as some of my dear, dear friends and colleagues who have studied with me were using it, that I looked back into it. And then due to certain health challenges of myself, which again, I always try to use something on myself as well. I started using ozone on myself and I went, oh my God, this has evolved so much since I tried looking at it 25 years ago. And this is great. And this needs to be part of veterinary medicine. And even though I'm not in active veterinary practice right now, good, close friends of mine all over the world are using ozone therapy in their practices. And we Skype and we Zoom, we talk about cases as part of when I mentor other vets, as part of one of my mentoring programs. And they're getting great results. And I'm like so excited that it's available in a much more practical way now for veterinarians. And I see that as just growing and growing and growing in 21st century integrative practices. Okay,
Yeah.
This isn't all scheduled or talked about. I'm just being spontaneous with my enthusiasm. And that's why I agreed to do a webinar with you.
Yeah, and wasn't one of the, didn't you say, you emailed me like yesterday or the day before and said one of those friends of yours was Dr. Makito Washitsu from Japan? Yeah. And he was just with you a few days ago, right? And
yeah, it was great. He just came up. He's the one who brought me to Japan 25 years ago, and we've been friends and colleagues since then. And he's been bringing me to Japan regularly to teach, and his one of his daughters and grandkids are in Oregon, and he called up and he said, hey, I'm nearby. Can I come up? And so he came up for the weekend, and then another local human acupuncturist who I made connection with him, he came over, and we had like this mini acupuncture conference here this weekend, talking, practicing on each other, and it was just fantastic. And he uses ozone regularly in his practice.
Yeah, and that's the first time I did a training was at his university in Japan there. And Margot and I went over and did the training there at the university, and then went and saw his clinic and everything. It was so neat. But let's get back to what you're talking about here and look at some of these other treatments.
And there are vets all around the world. There's one veterinarian in Israel, Yael Beal, that I mentor, that she took the training in ozone in Italy. And she's just sharing with me all these really great stories on geriatric dogs, on all sorts where it's helping. So other things that are going to be increasing in frequency in the use in a 21st century practice are PRP, which we all know about, and stem cells, but combining them with ozone therapy. And matter of fact, today, by my acupuncturist naturopath, I just had what she calls prolozone therapy, which prolotherapy combined with ozone therapy injections, and which instantly, I have some hip challenges right now as from adjusting too many horses for too many years and getting up on them and stuff. And by the end of the treatment, by the time I got home for this, I'm better already. And then there's some of the other ones I really wanted to focus on here are mind-body medicine for improving stress management, because as we see in all the veterinary journals right now, it's unbelievable that suicide, anxiety, stress, depression are an epidemic level in veterinary medicine. And of all the different healthcare professionals, we have the dubious honor of having the highest incidence. And I've been teaching mind-body medicine for over 20 years at veterinary conferences, including the AVMA and many other workshops all over the world, based on training I took at Harvard Medical School that they were at their Department of Mind-Body Medicine that they were giving to physicians. And I was the only veterinarian that they allowed in the course. And I took it, and then I share a lot of mind-body medicine for improving stress management. And in some of the workshops and some of the things I give, I go through everything from first aid mind-body medicine to long-term management. So what you can do when you're stressed, and I've had plenty, I burned out a few times. I always joke and I say, I teach what I most need to learn. And I needed to learn because of my passion. I was always burning out doing these things and not setting healthy boundaries, because everyone would say, Dr. Shoen, you're my only hope. And then my reception would say, okay, we'll fit one more in at 10 o'clock at night and this and that. And I go, okay, you know. So then the next one is the HeartMath Institute and heart rate variability. This is something that is being integrated into human medicine tremendously right now. And I'll be interviewing actually the scientists behind all of this on my new TV show soon, where he's going to review all the science on this. And if we have time, well, I'll go through some of the basics of it here. And then what in the last few years, I came up with my own theories where I've integrated the latest in neuroscience with the latest in quantum physics and the latest from HeartMath into a whole new approach to veterinary medicine, where I propose my two theories, the trans-species field theory and the compassionate field theory, which we'll go into shortly. And then there's sound medicine, light medicine, as well as additional therapies that will still unfold, like gene therapy and things like that.
Mm-hmm.
Okay, so here in a nutshell is my trans-species field. What it does is it measures, there are measurable electromagnetic fields between humans and animals based on the HeartMath Institute, and you go to them to look at their studies. And I combined that where 5 years ago I asked them, I see you're doing these electromagnetic field measurements between people. What about animals? And they went, that's a great idea. And within a couple of years, they started measuring the electromagnetic fields coming off people and their dogs and people and their horses. In a nutshell, what it essentially shows is when you feel a lot of loving kindness and compassion for your animals, you actually, your heart there's increased vasodilation, increased microcirculation, and with that, you create a broader electromagnetic field that radiates out from you for quite a few meters, okay? And when you're in fear, and there's fear between you, you get vasoconstriction, that field decreases, okay? And the measurements are all there. So that's one. Two is what I talk about is the quantum fields, these fields based even beyond that, based on the research by the two Nobel-winning scientists, Max Planck and Albert Einstein, as well as Dr. Nassim Haramein, he'll get a Nobel Prize soon for his new theories adding on to Einstein's theories on the unified field theory and consciousness. And so I took all of that, and they've never been integrated into veterinary medicine and the human-animal bond before, and that's what I've been doing, my passion over the last few years. And then there's also research from the University of Wisconsin Neuroscience Lab by Dr. Richard Davidson on the effects of quiet, focused intention on compassion for all beings. And essentially, what he showed in University of Wisconsin freshman college students, he divided them into two groups, and he did functional MRIs on them, and the first day of freshman week, and saw what their brains were doing. Then he divided them into two groups. One group, they just kept on being freshman college students. Second group, he trained them to do just 10 minutes a day of quiet, focused intention on compassion for all beings. Then he repeated the MRIs just 2 weeks later. And what he found was the group that was just staying as crazy freshman college students, nothing changed on their functional MRIs. But the ones that did just 10 minutes a day of focused, quiet intention on being compassionate, loving kindness for all beings, the area in their prefrontal cortex for joy and happiness lit up. So what that shows is just 10 minutes a day of focusing on compassion for all beings, on being a benefit to all beings, can actually change your brain, okay? And so I combined all of these into my next theory, which you can apply right after this webinar, okay, which I call the compassionate field theory.
Okay, one quick question, because Dr. Ying had a question here. She asked, how can you get an animal to stay still enough to measure their HRV?
I'll be talking about that. That's more beyond this webinar. Okay, but Dr. Roland McCready will be sharing how he's been doing that in his studies at the HeartMath Institute on February 3rd. I'll be interviewing him on my new Awake TV show called Awakening with Your Animal Family. And that's going to be one of the questions that he explains. So,
okay, and you're going to talk about how they can
what's that?
Get access. You're going to talk about how they can get access to that or see that later on.
Absolutely. And this is going to be part of my vision with a new TV show. It's on internet TV, on the Awake TV network, is I want veterinarians like Dr. Ying, and I want to create a new co-creative adventure of us figuring this out and co-creating this coming into the future, which I'll be sharing that more.
Right.
So I define the CFT, the compassion field theory. It's a dynamic, interactive, energetic field that exists between humans and animals that is based on quiet focus, intention of compassion for all beings, just 10 minutes a day. So what I would start with, and I've done this now in a number of practices, and I've done this in a number of horse barns, and we're introducing it at different animal shelters around the world. And what you do is you start out with yourself so you see that it works. And before you start your day, you just get quiet, take in some slow, deep breaths, and you focus. You can say whatever feels right to you, okay? But you focus on being of compassion and benefit for all beings. So like what I say is, every morning I say in these 10 minutes, may I be a benefit or a blessing to all beings today. And then allow the magic to unfold, okay? And you can find whatever words resonate for you that works for you. So it's as simple as that. Then the thing is, once you do it for yourself and you see, wow, this is impacting on the way I'm experiencing my veterinary practice, the way I'm interacting with animals, the way that animals respond to me, the way I interact with my staff and the way my staff responds to me, the way I interact with my clients and the way they interact with me, then you go, gee, at the next staff meeting, I'd like to share this and the scientific basis of it, because it's all science-based. What I love is these are things I had feelings about, and you kind of know as a veterinarian, but there wasn't a scientific basis to explain it. Now, with the latest in neuroscience, quantum physics, and heart math, we have a scientific basis to understand it. So then you share that with your staff and you say, staff, if you would like, let's do an experiment and see what that does. If you do 10 minutes a day of quiet focus intention on whatever words you use, may it be a benefit to all beings, and let's see if that changes the field, the energetic field in our hospital and the way we treat animals. Because every veterinarian I talk to when I lecture on a much more expanded view of this all over the world, they say, how many of you go into an animal hospital or an animal shelter or a horse barn? And one of them you go, wow, I feel so great when I'm in here, and that brings a smile on your face. And then there's another one you go, oh my God, I'm going to that one today. And you go, ugh. And then we all have that feeling. But then what is that feeling about? Now, with what I'm calling the compassionate field and transspecies field, we have the science behind it. So
let's get really practical for a second here, if you will.
Yeah.
So let's look at just any clinic, and let's say they have five vets, technicians, just staff who work there, and let's say one or two of them just is not the type of person, doesn't have the makeup, maybe just a negative type of person, let's say, that maybe this wouldn't go over very well with. How do you deal with that?
Jonathan, you're asking really good, very spontaneous questions, as well as the audience listeners are. And I had firsthand experience with that, okay? When I used to have 2 animal hospitals, 24 employees, this and that, and there were 1 or 2 that were all so negative. And I used to send, after a staff member had been with me for 6 months, I gave them a weekend somewhere to go on retreat to rejuvenate their soul. That was their bonus, okay? And I really believed that, and we defined the one that worked for them. Well, there was one that really, she was working in the clinic. She wanted to go to vet school. That was her plan. but she was such a, what do you call it? Negative nanny, Nelly, negative Nelly, and she would always complain everything. And so as I was sharing this with my rest of my staff, and they were all excited and happy, she just kept, so negative. So I said to her, and I said it to the staff at a staff meeting. I said, with the new year, what I've realized is I really only want to have staff here who want to be here and who are happy. Mm-hmm. And I really want all of you to take that in and think about, are you happy here? Are you grateful? And if so, write what you're grateful about, what you're happy about. And if you're not, ask yourself, do you really want to be here? And if you don't want to be here, you should leave. Later that day, she came to me crying and said, I realize I'm not happy here. The truth was she wasn't a happy person, okay? And so she ended up leaving, okay? And that's the way I've dealt with it. There are many other ways to deal with it, but I just try to nurture people to realize, are you happy or if you're not happy? If you're not happy, figure it out. Is there things that we can do here to make you happier? And if they're not, then you need to move on.
Yeah, I think that's really good. And I was at a vet clinic maybe a couple of weeks ago, and there was just one of the techs there was just really negative in the time that I was there, and I was thinking that has to be hard day in and day out. And sometimes it's better for everybody to move on quickly rather than trying to smooth all those things out. Now, it depends on the situation, but
each situation is different. And I was just playing with these things because I just wanted a happy staff like all of us do. And that happened to work. Most of the time was I would bring it up in a staff meeting and then personal one-on-one with the person that wasn't happy, and they would realize that it was time for them to move on. So this is brings up what this part in the compassion equestrian, I wrote about it with horses, but I'm doing the small animal version of this now, is if changing the way you work with your animal family could change the world, would you do it? And that's where I'm going next. And that's what we'll be talking about in the Awake TV network one, is that if we go and we relate to this and it makes sense and you're incorporating it and you say, wow, this really makes sense, we can create these harmonious resonant fields in our own hospital and animal shelters and horse barns in our own homes. So what I find is when I talk about this with animal lovers, they start bringing it home to their own house and they're seeing it. And staff then show up doing it. And horse barns, I've trained the trainers at the barns to do it. And then it has a beneficial flow that goes from there. So what I say is share these fields of compassion, loving kindness with your clients, your staff, your communities, and the world. And my vision for animal care centers in the future is that we can be much more expansive than just veterinarians, that our animal care centers can be global healing centers, because we all know, gosh, the world sure could use some healing and happiness right now. So if we can create these compassion fields between our staff, animals under our care, clients, and all we interact with, and integrate that, then from there it expands out, it radiates out to everyone we meet and interact with that day, whether it's the cashier at the supermarket who's having a hard time or this or that, and these fields spread. And here's a measurement. This just shows you that they're also measuring the heart-brain-earth coherence, that there are these torus fields emanating that are being measured in our heart and in our brain that are at a similar resonance as earth resonance. So, I mean, this is such an expanding field. When I talk about 21st century integrative practice, is this science is unfolding every day. And my passion, again, is integrating the latest in this to make healthier, happier veterinary practices and the world.
So there's a quick question from Dr. Reddick who asked, when is your small animal version of the book coming out?
Ha! Thank you for asking that. It's in process. Most of it will start showing up on the Awake TV show, okay? Because what I'm finding is it's about 2/3 written, and that what I'm doing is, as I'm getting asked to share this bigger vision on the TV show, it is going to be simultaneous with the book. Mm. So stay tuned. And ask me, Dr. Reddick, if I can help you more on this, let me know. Because to me, it's all co-creative and interactive. Mm. So my vision for the Global Healing Centers is every human-animal heart connection can be a gateway to healing all of society in the world. And if you and your practice would like to be part of this new vision, and this is addressing just what you asked, you can contact me at my website, Dr. Shoen, shoenoffice@gmail.com. Quite unique, just shoenoffice@gmail.com, and SCHOEN. And you can join. What I'm doing is sharing this vision. This is a new movement to create a more expansive perspective on what veterinary and animal healthcare can be in the 21st century. And as I mentioned, so starting next Monday, in less than a week, I was asked to share this perspective on this brand new TV network called Awake TV Network, which just began, about a little over a month, 5-6 weeks ago, and it's already in 55 countries. And you go to awaketvnetwork.com, and it will be a live show with question and answer to help co-create and nurture a global family of animal lovers, creating a global compassionate field to help benefit society, the world, and each and every one of us. This just came out an hour ago, and that's why, Jonathan, I sent you a new revised PowerPoint. This is the tentative announcement for it. So you're really getting things fresh off the press.
I guess so.
With your animal family, and it'll be on every Monday night at 5 p.m. Pacific Standard Time or 8 p.m. Eastern Standard Time. Awesome. And so I want to thank you all for being open to exploring this more expansive view of animal healing. And I look forward to connecting with you more through the TV show, through my website, through emails. My vision and wish and intention for everyone is, may we all be a benefit to all beings. Mm-hmm. And may we all go forth and do good and do everything we can. And ozone and all these other therapies are part of that. So open your wings and fly, soar. And I want to thank you all for listening, and I hope that this was of benefit to you. And thank you again, Jonathan, for inviting me on your webinar.
No, my pleasure. Thank you so much for being with us. Now, I want to give anybody who wants to a chance again to ask some questions. While you're thinking about those questions and putting them in there, I'm going to go ahead and briefly share the offer. So what we just recently came out with was something that is probably the easiest way to do ozone, and it's actually ozonated olive oil suppositories. So it doesn't get any more simple than that if you're going to do ozone therapy. And it's also something you can send home with clients. So what we have is, again, it's a brand new product. Just today we put it on our website. So if you're interested in that, we have just a few of these units available. We started with a pretty low quantity on our first batch, but these suppositories are available. And if you use code 241, the number 2 and then the word 4 and then the number 1, when you check out on our website in the next hour or so, you'll get 2 for 1. So you can give them a shot. It'll be half price again for the next hour. So if you're interested in ozonated olive oil suppositories, again, for me, I think it's such a useful, beneficial thing for clients to send home with them. Keep it in their freezer. Use one a day. It's very simple. And as long as they're okay with doing that on their pet, inserting that in there, it's just a good, easy way to do it. So even one step.
And I'd like to order some.
Okay, all right, fair enough. Yeah. So just wanted to throw that out there, and so go ahead and let's see. I'll put that now out for you guys to see. Okay, so obviously this message and what was said here this evening was you covered a lot. I have one final question, and I will get to that, Christine, in a second. But I have one final question for Dr. Shoen. If you were forced to take, your five or your top 3-4 modalities, that we're talking modalities here, okay? So it's a little bit different than obviously the mindset and that type of thing. But the modalities side of things, right now, what would those be? And I don't feel obligated to mention ozone. I realize you didn't use ozone when you were practicing. So what would your top 3 or 4 modalities be that you said absolutely every vet has to be using these in their clinic?
Well, I don't know if I could limit it to 4. And ozone, like I said, from what I'm hearing from my colleagues and friends that are using it, that would definitely be part of it. What I narrowed down when I tried all these different therapies for 40 years, the ones that were my truest, most predictable, reproducible, and safe were a combination of acupuncture, different types of botanical medicine, from Chinese herbal medicine to Ayurvedic to Western. Yeah, turmeric is phenomenal. So botanical medicine, acupuncture, supplements, some of the manual therapies, the laser, low-level laser therapy, and ozone. Okay, so I'm narrowing it down to 6. I can't do 4. Okay.
Fair enough.
That combination will take an integrative practice. You'll be able to help so many animals that are not responding well to Western medicine and surgery.
That's great. That's really helpful. Okay, so I had a couple questions asked. There is no weight difference, Dr. Hein. There's one, as far as the suppositories go, there's one size that we have right now. It's, I believe, 2.3 milliliters on that. And as far as how much to give, typically it's just, you can give more than one suppository. What I would recommend, though, if they're doing rectal ozone therapy or another ozone therapy method at your clinic, or if you're a mobile practice, you're doing it for them at home, then this is something to supplement what you're doing. I would certainly, if there's anal fissures or other things like that are an issue, use these suppositories as a great treatment for that type of thing. But I would use the suppositories more as a way to supplement some of the other ways you're administering ozone therapy, maybe once a week, and then giving them that to take once a day at home if they don't have their own ozone generator to do that at home. And so there's not as much research that I'm aware of on suppositories. We do have enough research on ozone oils and the use of ozone oils for skin conditions in particular and oral conditions. But as far as the use of ozonated suppositories, it's really a newer product, but we can safely assume some of the same effects we're having for ozonated oils and for rectal insufflation are going to be there for the suppositories. I know some veterinarians, anecdotally, that are using them and have really loved them. But that's what I would say about the effect at this point. So, okay. Any final questions? We're right at our threshold here as far as time goes. I do want to again say thank you, Dr. Shoen, for being with us. Do you have any final comments you want to make?
Well, thank you all again, and it's a joy to share with all of you. And if any of you are interested, because I don't go out and teach that much anymore, but if you're interested in doing any retreats or workshops with me, right now I don't have any schedule, but usually what unfolds is some veterinarian or veterinary conference or veterinary group says, we would like to host a retreat or a workshop with you on all of this. And I love doing that. Okay, so if any of you are interested in doing that, or being a one-on-one, me mentoring you or things, I have flexible programs like that. My main goal is to take the 40 years of pioneering all of this and being able to share that with others so that more animals, more people can benefit from it all.
And I'm going back to your email address so that if anybody, again, needs to take a note of that, they can do that.
Yeah.
And get in touch with Dr. Shoen that way. So, all right. I think that's it. So what I wanted to do again is just say thank you guys for being here from O3 Vets, and have a great night. That is it for this evening. So we will.
Thank you, Jonathan, for inviting me. Really appreciate it.
My pleasure. We'll talk to you soon.
Okay. Bye for now.
Bye-bye.